Boy, it is very nice to see all of you, and I'm not going to mention the Blue Jays, and I'm wearing red, so not for the other team. I thought I wouldn't have any slides today or photographs because you've been inundated with graphs and models and slides, but I couldn't resist showing just one picture because if Joshua could show a picture of his daughter, I felt that you should see a picture of my daughter getting married after I'd had 8 weeks of radiation, after my husband had chemo and 2 months of radiation, and we were there at the wedding, and it was something to hang on to. So it is, and you can take the picture down now, but it was a fun wedding, very joyous. It is a pleasure to be here. I happen to love this sector and feel privileged that I've worked in it, that I've participated in it as a patient, and that I'm here today. So I will make this a fairly personal presentation. I have lots of speech-like things that I wrote, and as I sat here today and realized that the messages are very consistent, I'm just going to tell you my experience in the healthcare system, and it'll confirm much of what you already know and much of what you're already doing. Healthcare has always talked about the patient at the center. If you went into a hospital in the early 70s, it would have been part of a mission statement. If you went into a hospital in the early 80s, as I did to give birth to children, it was a plaque on the wall. But it was more a notion than it was a reality. I think that what we're seeing now with the conference of this weight, of this enthusiasm, with these documented projects, we're seeing a great advance. But for a long time, it was just words, patient first, patient at the center. When I started at First Hospital, I recall as a communications person, I was telling Jennifer about this, I went into the emergency room and there was this huge sign on the wall in thick black letters, all in caps, and it said, "You will have to wait." Now, it didn't have an exclamation point, but that was the message. And I remember saying to my boss, well, maybe we could soften the sign by explaining why people had to wait. And he said, "That's not your area. You're in communications." And he meant it. That was the sad part. So I think now, if I've learned anything having been a patient, I would say to push harder on the communication side, because everything we're talking about with the patient at the center is about communicating. I started at Mount Sinai in healthcare because I wanted passionately to work in this sector, and I loved it. I loved it, and I was sorry that I had to leave because of this pesky brain tumor. But I remember sitting at the table at Mount Sinai as an executive, and we'd be figuring out metrics for success, the way we did at United Way, in fact, metrics of success. One, how many people came into the emergency room, how quickly they got treated, how quickly they got up to the unit that they needed to be, if they came back, what was our morbidity rate, all those things. And then when I became a patient and put on the blue hospital gown, which is the most democratic piece of clothing the world has ever known, I discovered that for a patient, there's one metric, and that is simple: treat me like a person. I adored being an executive at a hospital, and when I was diagnosed with a brain tumor that is inoperable, the good news is I heard the final word, which is benign, and when you hear inoperable brain tumor, that's the word you want to have afterwards. And I received really excellent care. But actually, the tumor was diagnosed 15 years ago, and in that 15 years between the time I first started treatment to the time I recently received treatment, there's been a sea change in the approach for patients. I always received excellent care, and I am truly a grateful patient. I am optimistic about the future of healthcare because you get excellent care. And I've always found that the bricks of our healthcare are excellent. It's the mortar between the bricks that's often chipped and dulled and uneven. And if you think about it, every clinician I had ultimate faith in, the brain surgery, go right ahead. But it was everything in between and how you were treated. I remember being with my surgeon, who's known me for 10 years. I have MRIs twice a year. We go in and assess the results. And he walked into an appointment with me a while ago, and he had my file in his hand, and he walked in and he said, "Well, who are you? What are we talking about?" Now, in that circumstance, what I should have said, "I'm here for my dancing lesson," obviously. But you can be funny or you can be absolutely reduced to misery. And I was reduced in that moment, knowing that I didn't expect him to remember my name. He must operate on 1,000 brains a year. But what I did expect him to do was glance at the file, acknowledge that I was a person, and just pretend. And it would have meant a lot. I remember being in a waiting room. Now, what you learn as a patient is they don't call it a waiting room for nothing. It lives up to its name. So I went to the waiting room for my 1 o'clock appointment, and when I walked into the hospital, it was clearly chaotic. There were patients who weren't in seats, there were their families, there were translators. The hospital that I was going to is in a catchment area with a lot of an immigrant population, so there were a lot of support people. Most of those people had had their appointments since 8 in the morning, and it was now close to 1. So I figured I was going to have a wait, and I'm okay. I'm very patient. I have my devices and my magazine, and but I watched for hours as the 2 administrators in the unit sat behind a glass wall and let everyone come up and yell at them for hours. What's happening? Why aren't we being seen? And I thought if they had any inkling of customer service sense, if they'd gone to Disney World and got trained in how to deal with customers, and they would have gotten up from behind their desk, walked in and said, "We're really sorry. There's been a problem. Go have a coffee. We'll let you know." It was all that people needed. So I waited from 1:45, and at 5:22, I was shown into the clinic where I sat in an examination room. And again, I'm fine. I'm understanding. I work in healthcare. I know the pressures. And the doctor comes in carrying a clipboard, looking down at her clipboard, and she said to me, "Okay, read the chart," because it was an eye clinic. And I was a bit stunned, and I said nicely, I didn't yell at her like everyone else had been doing all day. I said, "We have to start over." And she looked at me astonished. I said, "We don't need to be friends, but we have to have some kind of a relationship. So you ask me my name, and you tell me yours." And I said, "And trust me, I don't want to be your best friend, and I don't want to go shopping with you, but I would like to know that we have something together." Well, I think she was absolutely stunned, and she was fantastic. And she said, "Oh my gosh, I am so sorry." And I said, "No, you're focused on your mission. Your mission is to help me in my eyesight," because at that time, the tumor had given me double vision because it was pressing on my optic nerves. So you're lucky to see me. I've been wearing a patch very artfully for 5 years, and it was just fixed. So anyway, we became very good doctor-patient over the years, and she often remarks on that moment when she realized her focus was the chart and not the person. And it's such a simple thing. It's such a simple thing. I had remarkably good experiences in the healthcare system too. I remember talking about my double vision to a nurse who came in, and I think it was a nurse, it was somebody in a nursing outfit, I don't know who it was one night, and we were talking about my double vision, and I said, double vision is fantastic when you're watching fireworks, because I just take my glasses off, and I get double, and I don't need any LSD, it's fantastic. And it works for constellations too at someone's cottage, it's all good. Anyway, we had that chat, and in the morning when I woke up, and I should have brought it with me, but she had left a greeting card which had fireworks on it with a note without a signature just saying, "You're bringing fireworks to care," or "We're going to look after you," or something very kind. And I thought, she thought of me as a person. We had a conversation, and she responded to it. And if you're in the audience, thank you. I don't know who she was, but she was great. Healthcare is all about the little moments. It's so simple. The care itself is in great hands, and everybody who goes into healthcare goes in for the right reasons, whether you're coming in as a volunteer, as a nurse, as an anesthetist, as a doctor, as a board member. You go in because you want to make a difference in people's lives. And I think, sadly, what happens, despite the training and despite the catalyst to get you here, over time, whether it's the pressure of deadlines, the pressure of metrics, the pressure of budgets, the emotional pressure that you must feel dealing with patients and their families and outcomes, whatever the factors are, it gets kind of worn down. And the brusqueness that can actually be translated to the patient is sometimes breathtaking. When I was diagnosed with the second brain tumor, or that the brain tumor had come back, and I was in the pituitary clinic, which is a very alienating setting. You're in a theater with people you don't know. There's about 40 people around the table, none of whom introduced themselves. But the doctor showed my brain on the back of the wall, so I couldn't see it very well, and said, eventually we'll have to operate. And being something of an A-type, I said, well, let's schedule it now. I'm younger today than I will be tomorrow. And he said, no. We never go into the brain unless we have to. And I said, well, we'll take it out. They had taken it out initially through my nose. So I said, you'll take it out through my nose. And he said, no, it'll be a craniotomy. And I stupidly raised my hand and said, what is a craniotomy? And he said, it's brain surgery. And at that moment, I thought, gee, for him, it's like I would type a letter. It's the routine of his life. He does brain surgery day in, day out. He does it brilliantly, and God knows I'm grateful to him. But he forgot that for me, it's my only brain, it's my only time, and it's my real fear. And if there's anything you want to say to a healthcare practitioner, is what is routine for you is often absolutely terrifying for the person in the hospital robe. There's really no magic to giving people quality care that can't be done easily. And it goes back to lessons that your parents taught you. Basically, treat people as you would like to be treated. There's nothing more disempowering than having the blue hospital gown on. You've lost your business card, you've lost your title, you've lost your BlackBerry, and you've lost your sense of self. You are extremely vulnerable. And the people that recognize that are the ones you remember. I recall at one point, it was really gross, all my veins had collapsed and they had to do blood work and they had to go through my toes. And honestly, that was surreal and really painful. And one of the nurses in the emergency room just said to me, oh, come on, we do this all the time. And the other nurse took my hand and said, I know this is really painful. Just squeeze my hand while it's happening. And the next day when I was talking to her, I said, oh, did you have that done too? Because she was so sympathetic to me. She said, no, I've just heard that it's really horrible. And I thought, well, good for you for acting. It made me feel better that someone had gone through this. Try not to have blood taken out of between your toes. It's just horrible. I have experienced such a range of things, and it's usually the people that take that moment to say, inside that robe there's a person, and that person still has a brain. You're not stupid because you're a patient, and you have a life outside before and after, and you will again. And I in no way expect caregivers to start gossiping with you and talking about your family and your dog and your house renovation. But there is a way to connect with people. I was talking to Bob Bell about this at one point, and he said, well, what can we do? And I said, well, maybe make eye contact as you're walking around the hall. Maybe act as if you saw me. I was asked to speak at a conference early on in my days as a kind of patient advocate, which was very accidental and very rewarding. And the conference was called The Patient at the Center. Great title. And it had chief administrators, the chief clinicians, and the board members of this hospital. And I'm excited, and I'm preparing my 25-minute thing, which was, I did actually prepare it, and I didn't just leave it aside like this. And when I got there, instead of 25 minutes on the agenda, I was told I had 5 minutes at the end of the day. And I was very surprised, and I didn't know what to do. So I came up with my sheets, and I did put them down, and I said, if I were a cynic, I would say to have a conference called The Patient at the Center and have one patient speaking at the end for 5 minutes when all of you have your BlackBerries out and are ready to get out of here, I'd say you didn't really mean it. And then I said, but I'm an optimist, so I'm going to say I have the last word. And it was a great message that I blurted out. I didn't know how it came to my head. And in fact, they really listened to what I was saying because there's so much positive. I'm an American by birth, and all my American relatives, as I went through this long, long journey, would say to me, it's socialized medicine that's the problem, and if you were here, you could get an MRI tomorrow. And I would try to explain that my MRIs had to be spaced 6 months apart so we could see what was happening, but nobody really got that. But I know how good the healthcare is here. I know how fantastic it is and how grateful I am and how accessible it is and how when you are in an emergency situation, you will get the care you need. The challenge is always when you have a chronic situation. So in my case, I had a brain tumor wrapped around my carotid arteries, always at the risk of a stroke. It's pressing on my optic nerve, so I had the double vision, always at the risk of blindness. I had chronic pain, I had fatigue, a little bit of fear. And nobody was managing me but me, and that was very scary because my surgeon was fantastic and he cared about the surgical results. The pain clinic was interested in my pain but really didn't care about my eye. The eye clinic was interested in my eye, and I think the lack of navigation support was intimidating to me. Intimidating because there were massive administrative snafus, and as long as I'm unloading some of my stories, 6 weeks after I had the surgery, which was emergency surgery, and they got all the blood clot out but none of the tumor, I knew I was supposed to go back for an appointment, a follow-up appointment, and I hadn't been called. And so I called the nurse or the administrator over and over again. And when I finally got her, she said, no, you only have a follow-up visit if you've had surgery. And I said, I did have surgery. She said, no, according to the chart, you had an MRI that night. And I said, according to the 42 stitches in my head, and I can show them to you, I had surgery. It was just like a Kafkaesque situation. And I thought often during the journey when I was calling for an appointment and leaving messages, and those of you who have been pestered by me, and I think Andre's one of them in my role as communications person, I found a clever way to say, just want to get an appointment time, okay, next day. Don't leave me a message, just leave me the date and time. You don't have to say anything else. I don't need to answer the phone when you call. And I finally got in touch with a colleague. I said, I'm supposed to have this appointment before my next appointment, and I can't even get them to answer the phone or the message. It turns out when she investigated, there was nobody answering that phone. There was not one person who was aware of that phone, and that phone had the tricky device of never filling up the message machine. So nobody knew. And as I was going through this, I thought, my gosh, I speak English. You can see I'm not shy. I know people to talk to. I've worked in the system. What do people do if their language isn't English, if this isn't their first experience with healthcare, if they're totally intimidated by what seems like a forest of unresponsive, uncaring people? And the irony is, I know how responsive and how caring the people are. It's just that the roadblocks can be very, very intimidating. I was getting radiation at Princess Margaret, which is a whole different kind of hospital to me and a whole different kind of experience. Now, granted, it is 15 years later from when I first started, and the hospital where I started has initiated a massive and really deeply felt patient focus. UHN has done an amazing job, and I was part of lots of focus groups, lots of discussions. And at one point, I remember saying to Joy Richards, who's now heading that up as a VP of Patient Relations, I said, it's really not magic. It's like a AAA, and it's a different AAA from a session that I just heard about, but it's really just acknowledge the patient, ask what they want, act on it. Like that's really what patients are looking for. And now it's embedded in all their literature and on their lanyards, and they're doing important, serious work. And from the first day I walked into Western Hospital, where I was always lost, and I would say, well, I have brain damage, I cannot remember which elevator I'm supposed to go on, to today when you go to Western Hospital and 3 people volunteer and say, can I help you? Can I find you? Can I do something for you? It's amazing. But when we got to Princess Margaret, I needed to have months of radiation, and I went every day. And I think when you're facing tough situations and maybe facing death, you are very much more observant. I certainly was watching all the details, and I became obsessed with everybody else in the room who has cancer. Now, I don't have cancer, so I was one of the lucky ones just getting radiation. And has anyone here had radiation? Because if you have, it's a very odd thing. You say, oh, this isn't bad, because all they do is strap you down and beam you in. And after the first week, you feel like you're carrying a few bricks around in your bag. And by the end of 8 weeks, you can hardly move. You're so tired and sick. So I watched people get tireder and sicker, and they were coming in much sicker than I was. And I became obsessed by cancer. And my husband had a little lump on his neck. And he's British and stiff upper lip and male. And, it's nothing, it's nothing, it's nothing. And his doctor didn't think, I made him go to his doctor. She didn't think it was anything. They had an ultrasound for him. It didn't show anything substantive. And I said, I don't believe it. I don't believe it. And I begged, and he saw an ear, nose, and throat specialist who diagnosed him at that moment with throat cancer. And I remember Michael saying, no, it's not my throat, it's on my neck. And when the doctor said it's a secondary site, we thought maybe he knew what he was talking about. From that moment, we were in the system, and we were at Princess Margaret. And Princess Margaret, perhaps because it's sole disease place, it is a hospital treating a disease, but all its staff are thinking about the patients with the disease. It's amazing. I always called him the doorman, but he was actually a security guard. And as you go into Princess Margaret, he treats you like you're coming into the Four Seasons. The receptionist, who's an information desk officer, somehow keeps track of people coming in and say, oh, only 4 more weeks, you're halfway through, Michael. The technicians, the cleaners, the doctors, it was amazing, to the point that my stiff upper lip British husband, the day before his birthday, and he was in the midst of all the radiation and chemo and stuff, said, would you make me carrot cake cupcakes today? And I said, sure. I said, but you have a feeding tube and you can't eat them. And I was genuinely surprised by the request. He said, no, I want to take them in to the technicians tomorrow, because every day I go in for radiation, they ask me what my birthday is. And there were lots of jokes about his birthday, and he would be spending his birthday with them. So I made the cupcakes, I brought them in, and they had balloons for him. But it was, to me, a symbol of how they treated him as an individual. It wasn't just another person coming in to get, burned. It was astonishing. And I think that's a measure of where we're heading with healthcare. You can feel it. You can see by the prizes, the awards, the documentation. I think what's been done at the Kingston Hospital with under Leslie's leadership about the patient, nothing about me without me. The difference that patients can make. And I had the privilege of judging awards for the Change Foundation, and I see it firsthand of this initiative to actually connect back to the patient, and communications is the link. Now, I was really fortunate in my life, and when we were facing all these challenges, somebody said to me, don't you ever ask, why me, why us? And I thought, well, no, because why not me? And in fact, you don't question why the good things happen to you. I had a great career, I have a lovely family, I have great friends, so I didn't say, boy, why is that happening to me? So when the bad things happen, it's to be expected. However, what is amazing is the care that you receive and the concern of the community and the support you get. I wanted not to be a self-pitying, whining, stay-at-home mother who was just always going, oh my God, I loved my life and look what's happened. I'm going to watch another movie. I didn't want my kids to see that. And I wanted to give back some way. And the only thing I know how to do, I don't knit or sew or anything, but I do communicate, and I wanted to sort of take my communications ability to tell the story of how you can be in the sector as a professional, in the sector as a patient, and in the sector as a caregiver. And I promise all of you clinicians, I'm not going to try to give care. I'm not going the fourth part of that. But it was a wonderful window on how good our care is, how good our people are, and how the very simplest of things could make it fantastic. It's a simple thing of communicating, it's a simple thing of connecting, and sometimes that connection is more important than your tools and technology and expertise. That's table stakes. You go into a healthcare setting in Toronto or in Ontario, and you assume, that you will get good care. But what lifts it up, what warms your heart, what makes you feel less afraid is the human connection. And it may be that at a place like Princess Margaret, where the outcomes are grim because it's cancer, they're more in tune with how you're feeling as you go through the journey. And I think the best healthcare practitioners will actually put themselves in your place and say, okay, what could make a difference? Sometimes it's just holding someone's hand as they're getting the anesthetic. Sometimes it's actually smiling at them and asking how the night was. Sometimes it's commiserating with them, but it's always a one-on-one relationship that makes all the difference. I read that cure is really 20% technology and 80% human contact. And I have a feeling that's true. I think that's what makes the difference between really good healthcare that will get you where you need to go and really great healthcare that will make you feel it's a privilege to be treated here by these caring people. For me, I have years of experience. I've seen it go from a motto on the wall to actually being embedded in how the organization organizes itself, how it rewards itself, how it understands its team, how it empowers its team to make those differences. And I think that's a wonderful tribute to the work of organizations like Health Quality Ontario. It's a wonderful tribute to our province that we take this so seriously. Because trust me, as a patient, you can be a way better partner to your healthcare provider if you're treated like a partner and like an add-on, not like a number on the chart, not like just a procedure that they're interested in, but the real person inside who's going to respond and do well or not well, but is going to be your partner in the journey to make that health better. I don't even know how long I've talked. How's that for flowing without notes here? All right. I do want to talk one more second about the trust that's built, the interactions that develop. It's nothing you haven't heard all day and you haven't seen charted and you haven't seen in the documents. But if you're a caregiver, trust me, it's the most important thing. And it builds the trust between you and the patient that can never, ever be violated. It builds the trust between you and the family. And really, it's very difficult for family members and for patients to know how to strike the right chord with a caregiver. I wanted to ask a million questions, but I didn't want to annoy the guy that was going to save my life. You know the feeling. And I think that if there's a kind of open dialogue, if there's a kind of open feeling, you can actually make that difference. I'm going to give you 2 examples of that. When my husband had his MRI a few weeks ago, we were waiting for the results, and it would say whether the tumor had responded positively to the radiation and chemo. They never say cured, but your positive response. And the appointment with the oncologist, the radiation oncologist, was the following Tuesday. And on Friday, he took the time, it took him 2 minutes, but he called my husband to say, I just had a quick look at the scans, everything looks great, I'll see you Tuesday and we'll go through them. And I almost want to cry even thinking about it, because he said, I want you to have a good weekend. Compare that to the episode of a woman who was recently diagnosed with cancer. She got a call on her cell phone. The doctor said, are you sitting down? Oh, you should sit down. She said, well, I'm driving. He said, pull into a parking lot. And he said, you have cancer, it's terminal, and I don't think there's much we can do. And she's sitting in a home hardware parking lot getting this news in that fashion. Those are the same kind of doctors giving information in such hideously different ways. And I think it speaks to the range of ability to make a message, to make a connection, and to make it real for people. I would like to leave with one final comment, because I've lost the whole speech here. Forgive me. I love this quote, and I was interested that Peter Pisters is using it broadly as well, and he didn't ask my permission, and I didn't ask his permission, but the poet Maya Angelou said something that is so meaningful in terms of healthcare and healthcare delivery. She said, people won't remember what you did, but they will always remember how you made them feel. And this is the sector where that kind of feel can make such a huge difference. I am one of the really fortunate ones. I've had 15 years of all kinds of issues. I'm a serial optimist, and I knew it would work out. Or somebody said to me, you're sickeningly glad, but I am. And one thing I'm very glad of now is I've had radiation, I've had the eye surgery, I'm on a waiting and watching course, but without the fear that every headache is a stroke. My husband is good. You saw we had a really wonderful, joyous wedding. But I'm also glad because I'm involved in the sector, both as a patient partner, but also now I'm doing some work with CAHO. And it's really a privilege for me to be trying to promote and understand health research, because it's changed my life. I'm quite sure that if there weren't research, they wouldn't have been able to do the surgeries that they did. They wouldn't have been able to do the interventions that they have. And I wouldn't be here today blabbing on again with my story about what a journey it's been. And that's a terrible word to use because people who are in the journey hate the word. But it has been a journey. It's been an exploration of the very, very best, the thoughtless bad, and all the great things that are happening to improve it. So I salute all of you in healthcare. I'm proud to be one of your colleagues in a non-caregiving way, but in a very, very grateful one. Thank you.